All right, approval of minutes of the previous meeting of the 6th of this month.
And the others?
And the 13th.
And the 13th.
And the 13th.
I would move that the minutes of 5/6 and 5/13 be approved as written.
Second.
I'm not, I wasn't here for the first meeting, so I will not vote on
Okay.
those.
Any corrections, additions, or
Corrected them,
deletions?
but I-
Seeing none, those in favor? You get a copy of the...
It's right there, under your, right there.
Oh, the cost of it.
Yeah.
It's just so damn efficient.
I know.
All right. All right, let's take up that, has everybody had a chance to read
Yep.
that? Everybody content with that?
I've, like I said, Kim, Mike and I and Tammy, and does it make sense to you?
Yes,
Do you see anything wrong with it?
No.
We looked up mapping a lot, we know everything, the
Yeah.
year,
Everything looks good.
and you're okay with the $250?
Yeah, absolutely.
Looks good.
Yep, you
Okay.
want it?
A motion to accept that consent agreement and allow me to sign it.
I would move that we approve the consent agreement and authorize David to sign on behalf of the board.
Second.
Those in favor? Okay, I will sign it now. Kim, you've seen me do it, so you can,
So he'll sign,
Notarize it.
Tom, and then when your wife comes next week or whenever she can come,
Yeah.
you meet up with Kim.
Okay, downstairs.
And then I can't remember, do we record it? I might have had that.
no, usually they're,
Yeah, we don't do
It's
it.
gotta get recorded though.
Oh, okay.
So at the registry.
Yeah.
No, at the
The
registry.
county.
Oh, okay.
Yeah.
yeah,
Well,
the
it's-
county, and then that way if you, when the property is sold or something, you know.
Yes.
And somebody says, hey, wait a minute, the building's too close to the road.
Right, right. So once it's notarized, go to the.
Yes, make sure you take the original to the the courthouse up there.
Yeah,
top of the hill.
yeah.
You've gotta get it recorded.
Okay.
Then, to be honest with you, Mike usually likes a recorded copy brought back here
Yeah.
because he puts it in your file.
Okay.
This is very important, Tom, because
Yeah, yeah,
we're all
yeah.
gonna be going
Yeah,
someday.
If it's in your file, that way if somebody's looking to buy the property, they
Right.
come in, look at the file, they don't have to go to the courthouse.
Yeah. Okay.
And they'll
Oh,
know that
good
this
idea.
issue is
Yeah.
not an issue.
Yes, I appreciate it.
All right.
So you're good to go.
So that's it.
So take that, take that copy and Kim, and
Yep.
just get.
All right, beautiful. Thank you.
All right.
Thank
All
you.
right. Appreciate it. Thank you, Jason.
All right, selectmen's comments, Tom.
Nothing I could take much credit for, but the event committee did decide on having Woolwich Community Day on August 8th, Saturday at 11:30.
What's the date again?
August 8th.
August 8th.
And also, so I learned at the last Climate Resilience Committee meeting that GMR has still been unable to connect with the road commissioner. There was an interview that they wanted to do with him, and I don't know. I don't know what's.
Should he call, should they call?
Yeah,
Tammy?
call the office. I don't think
Yeah.
anybody, I haven't heard a word about this.
Okay.
Yeah, I was kind of
Have
surprised.
them call the office number directly.
Call the office,
And then
okay.
set up an appointment with them.
Yeah, but regarding culvert and road related.
Yeah, no, we're always responsive. I have not heard about this.
Yeah, okay, so that's just a thing they mentioned at the last meeting. That's all I got.
Our second select board meeting in June, which is the 17th, the special events committee would like to commemorate the 250th, the year of the anniversary of the revolution.
I think that's wonderful.
Yeah, and
They
so,
used to come every year.
yeah,
And put on a little shindig, and we actually got a few people, and it's amazing how many people have lived in this town for years and have never been in that
Yeah,
building.
yeah. Well, and I'm getting a cake and I'm getting a card table because Colette does not like laying the food out on the benches, so there's that. The other thing I was going to mention is that the legislature is in its second year of the property tax relief task force, and they're doing some meetings and they've done some surveys, and I sat in on part of it the other day, and it was really interesting. I'm going to get the slides about like some surveys about revals and and what size towns and what the experience of other towns has been. They will probably come up with recommendations the end of the year. But anyway, I thought it's been interesting going to it, and so I'm gonna
Mention to them about have their budget voted on countywide. You know, I mean, that, you stop and think about it, the impact on property taxes statewide.
Yeah.
And it's controlled by 60 people
Yeah.
in the entire state.
Yep.
60 people vote on hundreds of millions of dollars of spending.
Yeah.
With virtually no
Yeah,
oversight.
yeah. One of the interim recommendations they did at the end of this session, or just before the end of the session, was to fund the jails. And so there was that bill, which you heard Joel talk about at the county budget meeting.
Right.
It was only funded for a little tiny bit, but they're going through, like, what are the most effective ways of delivering property tax? And it's been really interesting, so I'll get the slides and send them on over to you when I get them. So, that's it. And, I guess the road commissioner's not here, but I was gonna ask about Montsweet Road.
Paving, yeah. Yeah, well, it's under contract.
Yeah.
It's under contract.
That's why I'm not going to this potluck tonight, because you're gonna ask me about it.
Well, he signed a contract.
Yeah.
It's with All States Paving.
Yeah, that's what I told him.
And
Yeah.
the schedule is always fluid.
Yeah, that's it.
Okay. Dale?
Nothing.
Jason?
Oh, just a couple of things. So we all know there was a leak in the fire station that showed up a couple weeks ago, whatever. Marked it out. Levi from ABL, if I got that right, Kim. They came yesterday, climbed up in there, talked to them today. It's where the light hooks to the roof, is what he said. So they resealed something, did something, and said if you have any more trouble, so let us know. Yeah, if you go out on the roof, there's a conduit, well, I call it a conduit, a steel pipe with the light that shines up on the
Tower?
yeah, something or other. So it's literally right there. But he went up through here. We saw Kim and called him today. So if there's problems, I will say he's very responsive.
That's great.
Showed up really quick. What else do I have? Oh, this is an EMS, I guess, week.
EMS week.
Yeah, and so obviously, I don't know if we keep up with all these things, but we, Danny and Sean, we obviously appreciate all that EMS and
Right, we certainly thank you.
Fire and safety.
You and your folks do.
all right, so the other thing is I did meet at the last meeting. I told you guys I was meeting with CMP and Ruth down at the dike. We did meet. They seem to have a handle on figuring out how to get across the span with new utility poles. They were in very good mood this time. Everything seemed to go quite well. No, it's totally different than the other meeting I went to. So that's good. The only other thing I have is Jenny Rich Smith reached out and she would like to meet with the board.
Oh, yeah, that reminds me of something else too.
She would like to meet with the board in July and have a discussion that doesn't have to be a full-blown meeting, but about things coming up with the RSU and some of the school consolidation and property. I think you know what I'm talking about. So she's given us specific dates though, and they aren't dates where we have regular meetings. So she's,
Wednesday night?
well, she's saying between July 7th and 10th that she could meet us at 4 o'clock or whatever someday. But I think the 4th is on a Saturday. So that means our meeting's on the 1st.
Yep.
And so the next meeting is on the 15th. So she's saying between the 7th and the 10th. I think I can make whatever, but we got a little time.
Yeah.
I know, we're busy.
And next,
We'll work around it.
Yeah, so well, I didn't pick nothing. I just told her I'd talk to the board and we could figure out something.
but that reminded me, if I can, the school board district meeting is next Tuesday.
Right.
That's when people can add things, and there is interest in adding some things to the budget. And if more people interested in adding stuff show up than interested in not adding stuff, then those things get put in the budget. So
What's the date of that
6
again?
o'clock. It's the 26th. It's next Tuesday at 6 o'clock at Morse, and you'll be there, right? Because you've got
Yes.
yeah.
Yeah, Tegan and Janelle will be there just so they can get the experience.
Yeah, yeah.
Because I'm gonna have them work, I'm gonna have them be the ballot clerks for, the special town meeting.
Oh,
So
good.
they can get used to
Yeah,
the,
yeah.
Size of a closet.
Yeah.
Well, I think they do it in the cafeteria,
No.
gym, I mean, don't they? Oh,
What?
what room is it in?
what, the
Oh, well, last
special town meeting?
no, the
No,
district
No, the
district
auditorium.
meeting has usually
Oh,
been in the
Oh, it's
auditorium.
auditorium.
Yeah. And then related to the special town meeting, do you want me to get runners, or is Tegan want to?
I mentioned that, Tegan asked about doing a runner, and I was like, people complained about, people not going up to the microphone. So why can't we just have people go up to the microphone? That way I think you're gonna eliminate all the hecklers, all
Some of the
the,
old people
you
can.
know.
Well, sometimes.
People can't walk around.
Yeah.
Oh, those old
Well,
people.
Danny,
I'll carry them, but
Well, if they're checking in and Danny's offered to do it, we will have 4 microphones. I will have all my.
Okay,
So.
So you want me to check with Ash, the Carls again, or does Tegan wanna?
Tegan can do it.
Okay.
Tegan can do it.
Okay. Okay.
But
All
one
right.
of the
I would
advantages-
encourage people to go up to the microphone in
Yeah.
the middle of the room.
A lot of people
one
did,
of the
actually.
Yes.
One of the advantages of having somebody run the microphone around, that lady that sat here that night, that said the people behind her were really gross and everything. I said, look, ask for the microphone. When they get there with the microphone, say, look, I really don't need the microphone, but take a message back to the moderator, you know. And then he can stop the meeting and say, look, we're not gonna tolerate this. There's gotta be a way we can get that communicated in front of the room, or else we don't know what's going on. We can't hear somebody 12 rows back, you know.
We'll set Dale in the back and he can smack people around.
Well, we're gonna have a deputy there anyway
Yeah,
this year,
yeah.
this time, right?
Yeah.
Yeah.
Yeah, I think we should, yep.
Yeah, okay, all right, sorry, I didn't mean to go out of order.
Okay. Anything else?
No, I'm good, it's you.
I have nothing.
Oh, we can tell the floats got put in.
What's that?
The floats got
Yeah.
We just put the swim floats in, and the young lady already ran to the end of them and dove in. So,
Just
can't
I'm
imagine.
right out there after you.
show off.
40-degree water.
Okay, public comments. There's no public. Bill, you want to say anything to us?
Yes, actually, I know it's been some interesting meetings recently, but Wisconsin had a school committee meeting, regular business, that lasted 5 hours.
Whoa,
Wow.
a committee?
About the budget?
No, this
Some
was
other
just a
stuff.
regular meeting.
Wow.
5 hours.
Yeah, let's
All
not
right.
ever do that.
So count your blessings.
Yeah.
Town administrator's report, Kim.
I really don't have anything to talk about. I was just gonna go off of what Mike Field was gonna comment about the 1170 Old Stage Road. So I'll let you can read that, and then I might throw some
Okay.
comments in after that.
Road commissioner's not here tonight.
No, but he did call, and he said he has been grading all day, so he's tired. Roads are in good shape, and he is still working and talking to the hot top people to get that all lined up, and that's it.
Okay. All right. CEO report. Issued 5 building permits, improved principal structure, 2 accessory structures, workshops, 2 residential roof solar, 3 plumbing permits, 2 internal, 1 septic, signed permit for the Eros Oyster Company in Georgetown.
Oh, Arrows, it's a blue,
EROS.
yeah, it's the blue directional business signs.
Okay. Home occupation at 400 Shops Road for a daycare. Complaints, mobile home on Great Corner Road, visited with Fire Officer Mike Demers. There was a large roll-out dumpster in the yard, met with the son of the owner. He had come from out of state to rectify the situation, including cleaning out, remove the wood stove, and fix the electrical issues. As of this date, all the matters have been corrected.
Have they
See,
moved?
reviewing a complaint on the Mountain Road regarding the condition of the home and owner. I've supplied a resource number to the owner, reviewing other options. 1170 Old Stage Road, our favorite house. Served a letter from the compliance division of the mortgage company requiring the occupants to vacate. I've given them to Tuesday, May 26th. Once vacated, the company plans on repairing the outstanding issues and securing the premises. George Wright Road sign sent a violation letter on May 13th to remove the sign within 10 days or face possible fines.
It's
So
coming
can I
right up.
do you have comments?
Are you gonna comment on that?
I'm gonna
or-
comment on another problem.
Oh, okay, so, yeah, so the lady, who is the compliance division for the mortgage company, she's very responsive. She has like an official letter that she's like, you know, the code enforcement officer and the Saginaw Sheriff's Department have every right to remove the occupants that are not allowed to be living there because, they have no jurisdiction or whatever, they have no
No tie to
no ties to that house. So the only problem is they, it's not technically in Scott Human's name. He's just the personal representative. Nothing ever transferred ownership when Catherine died. They were trying to like figure out who the heirs were. Well, it's Craig and Michelle. I have their information. I gave it to her through the probate courts. I've talked to Craig last year, and Craig and Michelle, they said they want nothing to do with it. So they're walking away from it. But it's all just going through the foreclosure process to get it transferred into Celine Finance's name. So I'm hoping that the occupants will leave on Tuesday, but I think it's gonna be a problem.
So when it's in the finance
But
committee's
if they
hands.
authorize the sheriff to remove them, the sheriff can go out and say, look, you don't live here, you don't have any right to be here, hit the street.
But who does that request come from, us or the finance company?
It's a letter from the finance
Yeah.
company that says, for the compliance division,
Yeah.
that says, you have no authority to be living here, and it's given the code enforcement officer and the sheriff's department to have these people vacated.
Okay.
But will they comply? I don't know.
Stay tuned.
Find out.
We'll find out Tuesday.
I would think if the sheriff shows up and it tells him to hit the street, then hit the street, but who knows?
But when I talked to Mark Anderson and told them that they did not have any ties to that, because he went and got the CMP in his name, he's now considered a resident.
Mm.
So that could be an issue. I don't know.
Any
But
changes?
anybody can, I mean, you could,
Exactly.
anybody can pay a light bill. I mean,
Absolutely.
You just call CMP and say, I'm living in
Yep.
Allison's barn and,
You would be
I want
welcome.
to meet her for the barn and.
Inner bowling alley.
So when he got the power bill in his name, he went to DMV and got a
His
driver's
license.
license that has that address on there. So
Wow.
as far as the sheriff's department's concerned, he's a resident of
Yeah.
Woolwich.
Yeah.
So
Well, we'll
Yeah.
see.
I don't think it's their first, I don't think it's their first rodeo, so they might,
Yeah.
might be an issue.
And then it becomes a civil matter, and it's up to them to take them to court and get an eviction notice.
Yeah.
And that can take 90 days, I can tell you that. I
Fingers
can
crossed
tell-
that
I
they'll
can
be
tell
out
you
on
that
Tuesday,
from
but I
experience.
don't know.
I can tell you that from experience. I used to own 13 apartments.
Try to get started.
I have a question. So, a couple of people have been asking me, like, for warrant article language for special town meeting. What's the timeline on
It says
writing?
7 days, I think, right? It only has to be posted 7
Timeline
days.
on
Yeah.
For like
10
post,
days.
well,
Yeah.
For
are we
posting
gonna,
it,
or just the language and posting it, but just, people have been asking, well, what are we gonna be voting on?
it's 2 weeks, right?
It's 7
It's
days.
like
7
7 to
days.
10
Oh, 7.
I mean, I've been telling people what it is, but I don't have the
Well,
official.
we haven't actually signed it yet.
We
Right,
haven't
are you?
signed it.
Okay,
Yeah, so
okay, all right,
Maybe in early
Okay.
June, right?
okay.
I got one more thing. So I did speak with Mike, and we all know about the ongoing property that's down on the old stage road before the bridge, right-hand side of not the addresses, the messes. So as you recall, the Webster Young, his mother passed away, and that was a few weeks ago. But Mike is of the mindset to start issuing some sort of an enforcement letter. I think we've been dealing with this for 4 years now. It's at least 3 years. So what do you want for some sort of timeline? Do you want 45 days? Do you want this one's a little different.
I wouldn't give you too long a time,
No.
just because I think if push doesn't come to shove, it's
Right.
never gonna get done.
That's
So
right.
I'd say 45 days.
Well, I mean, it's up to you guys.
45 days.
Mike said 10. I said, oh no, we can't do 10 days because he would never be able to clean it up in 10 days.
He's out of town,
It's
right?
gonna
He's out
take
of
more
town,
than 10
yeah,
days to
yeah,
clean that place
Yeah.
up.
So I just said we talk about it.
I would think, let's give him 45 days to get it cleaned up, and threaten if he doesn't, we will clean it up and.
Well, the thing is, we're gonna end up with
Leave the
rodents
property.
and all
Which
this
house
crap.
is this?
It's the one right before the
Right
bridge.
before the bridge.
Down at the end. Go by the. Go by
All
The
the.
little blue place with all the
All the
workers
Lincoln
sitting
Town
inside.
cars or whatever.
Used to
those
have
are.
Dalmatians and passed away, and cars, and it's gotten run
Okay.
down, tires and rodents and every other problem. It's pretty bad. Well, you see it every day, and I see it.
Okay.
And it's all open now.
I don't think we're
It's
gonna
the-
get anywhere if we
all
don't
The
push
the
it.
place needs to be moved.
Windows, doors are
It needs to be
open.
cleaned up.
Hmm.
Needs to
The
be-
doors are open?
Yeah,
Oh,
front
yeah.
doors
It's
wide
messy.
open.
All right,
Okay, that's it. That's
so
it.
let's turn Mike loose and tell him 45 days, okay?
Yep.
EMS director, Danny.
So far in May, we've responded to 15 calls, 14 patients seen, transported 11, called NC1 3 times, did mutual aid to Dresden once and Wiscasset twice, and Wiscasset came to help us out the other day when we had 3 calls going on at once. So, other things, as Jason said, it's EMS week, so for those, I don't know if my crew watches this, but thank you very much, and to our drivers and our providers, and
Thank you.
it's just kind of a time of year to celebrate them. We give them gift cards that they haven't picked up yet, but yours is in your box, Sean. 4 of us, as part of EMS week, one of the things you do is community education. So 4 of us went to Mom's Sweet Restaurant on Monday and taught choking response.
Wow.
It's a restaurant, and they asked us to come in, and so went over there and taught their whole staff choking response. So I'd still say don't show it once a week, but they'll know what to do now.
Wow, cool.
Craig Collins received his advanced EMT license Monday. We still have 2 that are waiting to test, so he got his first advanced call yesterday. Exciting one. And then the big thing, so I don't know how much any of you heard, but last Wednesday, every EMS department in the state got a letter from Maine Health saying as of July 14th, they are going to stop providing controlled substances. And as of October 1st, they're going to stop providing any medications. Problem with this is nobody has safes. Nobody has anything to put them in. It takes 3 to 6 weeks or more to get those. I applied for the DEA license, and I haven't heard back from them. Have no idea how long that will take. Maine Health reason was they said the DEA won't allow them.
Yeah, I
to
got a
provide
letter
them.
back from Midcoast Hospital.
We're working on letters, things like that. There's a lot with the state. Maine Health is wrong. Other states allow hospitals to do it. But they're using this as an excuse. And the October 1st thing, cutting off all medication supplies, coincides with their fiscal year. So it's something they've been looking to do. They're saying it's part of the DEA thing. They just finally rolled that back because it's not, and said, our distributors won't let us get.
So they have backed off on the DEA for the non-narcotics?
Sort
of.
Yeah.
Sort of.
Okay. Because I did.
So I've been spending the last week going through every possibility in the world, and I just had a vendor for narcotic safes here. And I've been researching all this, and it looks like there are options. We could lose our drop our paramedic level license, which does a disservice to our townspeople. Yes, we call MC1 a lot, but if they don't have the equipment, if our trucks aren't ready, if MC1 isn't ready and we have one of our paramedics, then we couldn't do that stuff. The other is that we buy safes, and I'm still trying to find vendors. It's obviously not easy to just go and buy narcotics somewhere. You have to go through all the DEA rigid. Once we get the thing, it's going to take a couple of months to get this. So it's this big thing. Thankfully, the narcotics aren't that expensive compared to some of the other medications. I don't know why. I thought they would be really expensive, but you have to buy them in bulk. And we're gonna have to. So basically, I've been researching safes for here.
But don't a lot of these medicines have a shelf life?
Yes, 12 plus months
So
generally.
how would you know?
We have to keep track
I
of
mean,
inventory.
what would happen if we bought what you thought was 6 months supply, and then at the end of the 6 months when the stuff is outdated, you've got a bunch of it left over? I mean, I just see that this could be a nightmare.
It's going to be a huge.
You can't get it as you need it. You've got to
Right,
find
and that's
it.
one of the big challenges. We're trying to find people. Maine EMS has been completely unhelpful. Their answer is, well, create buying groups, work together. It's like, well, you're supposed to advocate for us. Why don't you help us do this?
So they're not doing that. That's what I was going to suggest.
We got no help whatsoever. They're saying it's a federal thing and they can't do anything about it.
Has there any,
Even if you partnered it up with a couple of other local...
We couldn't do that for the narcotics. We can for the other medications.
okay.
Like
So-
a buying
But
club.
even if you did, I mean, how would you know that they didn't have a run on it, and then all of a sudden you're shot? I mean, it's just... This is going to be a nightmare.
I agree. It's going to be a
Hey,
nightmare,
let's
and it's going to affect. There are already rumors.
Every
of some,
agency in the state is going to have to do this.
There are already
Big and
rumors of
little.
some
And
smaller
not only
town
that, but
services going out of business completely.
So I reached out
I think the
to.
common sense thing in this, rather than having all the drugs in one location where it's pretty secure, they're going to be every small town that has an EMS
And then we also have the thing
service
of
is going to have
if
drugs
narcotics
in the building.
expire, we have to
Yeah.
pay
There'd
to
be a lot
waste
more
them.
incentive to try to get around our
Dispose of
law.
them. So the short term, it's going to happen at some point. What I'm surprised with is the deadline. Like July 14th, that's impossible for anyone. You just can't get the regulations. You can't build the relationships for this stuff in that time. So I'm guessing they will extend it some, but that's not certain. It will happen eventually for the narcotics. I've priced out safe systems. The cheapest would be around $10,000. That's without tracking. That's just for here. Wiscasset got a quote for about $25,000. Theirs is a little bigger than what we would need. So we're looking at about $20,000 for a safe system. I have no historical record about how much all of the medications cost.
Danny, just so I can understand some of this in my head, do we get the drugs free from Maine Health
No,
now?
no.
We pay for it.
Oh, right now, currently,
Yeah.
if we, narcotics, they charge to the patient, it's by code, everything, we don't pay for them, we get those for free, for the controlled substances. The other medications, if they're going to expire, they'll do a 1-for-1 exchange before it expires, so we don't pay for it. If we use it and we don't have it to trade, then we pay for it. But there's also the case that like glucagon, which is a diabetic.
So we're gonna be now billing every patient that
No, we can't. We can put it in the reports for the insurance company. It's just an added expense for, we can't bill
but it,
the individual medications.
right, because right now the hospital
They bill.
bills that,
Yeah.
right?
Well,
For
not,
the narcotics.
not most for the narcotics. Not most of the drugs, the medications we give on the drugs. They don't. That's built into the insurance thing.
Narcotics are cheap, so
Another thing
that's
is
not a
like
big part.
glucagon, which is for diabetic emergencies. It can be a lifesaver. It's for severe ones. Hospital price, when we've had to replace that, it's $110. Cheapest I've been able to find so far from suppliers, if you buy it in bulk, is $250. It's $350 if you buy them individually. So there's this is the unknown. Like, we don't have the buying power of the hospital, and there's not enough services that can get together to create a big enough thing to get those same prices. So we just don't have a historical record of how much this will cost. It's going to push the budget. Plus, we've already passed the budget. So, like, if they'd said a year from now, you know, like, we're going to do this, we would have more time. I'm guessing there's a lot of political pushback on the state level.
Hope so.
And
I haven't
I'm
heard-
guessing they're going to be forced to extend it, but I can't be certain. So
Yeah.
I'm looking ahead now for.
Yeah.
I'm just looking at all of that stuff and doing the research. Again, I've never bought narcotics, so I don't know how that's done.
I'm kind of dumbfounded. I reached out when these guys told me that. I reached out to MMA. They said they'd only heard about it from one other town. Freeport. They would reach out. In the meantime, I wrote to the Midcoast Hospital president, and he wrote back with this story about DEA and
I can tell you the medical directors who we've been under their licenses and the hospital's license for the DEA stuff. They told us about it, but not them. They heard about it from us and forwarding the letter.
So
So-
is every hospital in the state doing this, or just
Maine
Northern
Health.
Lights and
Maine
Maine
Health.
Health.
Just Maine
Oh,
Health?
Maine
And
Health.
Northern Lights.
So it's most of them.
So that's
They own
about 80%
everything now.
of the state.
Northern Lights that goes up is up.
Is
big,
there,
or-
is there any organization for all these EMS departments? I mean,
Well,
is
there
there
should
any, like,
be, Maine EMS should be
Maine EMS,
helping
yeah.
us.
no, exactly, but even if they don't, is there any way to get together, like, regionally, like,
We
just so
are
you can-
trying.
The other thing, I reached out
We
to
are trying.
the legislators in Lincoln County,
Yeah,
and they haven't, and like CLC, like nobody has heard anything, and it feels like I'm in this black hole. I'm
We're
happy.
getting the word out
Yeah.
there. Senator Libby, is it Senator or Representative Jim Libby?
Jim Libby,
From the
yeah.
health,
Okay.
he's like kind of the EM, and they are working on this and
Okay.
pushing back. But again, we don't know. We heard last week. We've been trying to just handle this. So we may have to. I think I may have enough under budget this year to buy safes if we need to. I don't want to, but.
Didn't you say that Wiscasset had been in touch with some other agencies to try to
Yeah,
team
so
up
the
on
Lincoln County EMS stuff, they get together, and they're working on it. Waldeboro's, they're in Knox, but they're going big with a Pixis system and stuff. We can't afford, I wouldn't even.
What about Bath and Brunswick?
I'm not sure what Bath is doing yet. Brunswick, they are buying new equipment. Freeport says they don't know what they're doing yet. Most of the services don't because, again, they had the DEA thing, which was an option. It's like, and we've been told the last 2 months or since late February that it will come eventually, but wait and see.
Would it be helpful to invite Chris Bow or whatever his name is from Midcoast to come and talk to us the way we had Lois do that?
I mean, I don't know. I could bring in Michael Schmitz with him, our medical director, who's really at the forefront of fighting back against this because again, there
I
are
mean, it seems like a good
agencies in the
plan.
mid-coast that might go out because
Well, clearly, it's all these guys.
It's a
George-
massive-
all of us are hit.
The impact on EMS services throughout the state is
People
just
are
gonna be
already
crazy.
saying, we're just dropping our
It's really-
paramedic level license, or, you know, which is an option we could do. We're saving the money of the safes and getting the narcotics. We'll still have to get all the other medications. So,
So the other medications don't require the safe cell then?
no, they don't, they,
We would lower our service level.
yeah.
But the safe is, you only need the safe to store the inexpensive narcotics.
Yes.
You still gotta buy the
And
expensive
then there's
regular drugs.
DEA, like tracking and stuff that has to go with it and access.
Yeah.
So this is a specific safe to,
Back
drugs,
up on this,
just for
apply that would
narcotics.
be next.
okay, so a regular safe,
No, they are required, they're not requiring it right now. There has to be like at least a card right now, but they're gonna be requiring soon 2 factors, so like a PIN pad and an RFID card or things like that. So it has to be really secure. Models I've been looking at go from just that for entry to they automatically track all the medications and keep the logs so you can give them to the DEA when you need to. And that's, like, I'm guessing Wiscasset got a quote for about $25,000. I'm guessing it'd be about 18 or 19 for us for that system if we went with that. Again, I'm still doing all the research. I've been talking to all the vendors. Kim brought up the guy from one of the safe companies who's going through the state today, and I just met with him. So it's,
So the safe companies are
I'm
looking
not
at-
sure
No, right?
right now because, again, I just got this and I'm still trying to figure it out. But I might be requesting money or to be able to use money to do this. I mean, it's important that we keep our paramedic level license to take care of our people. You know.
What do we do if we buy the safe and then they back off and say, I just
Yeah, I
didn't.
know, right?
Well, I would think, I know what you're talking about,
You
Danny,
put
but
your
I,
cash in it. I don't know.
well, no, but I would think also that like EMS directors and chiefs and providers or whoever the leadership would get together and have, I know
We're
you want.
trying. I mean, the email chains we have going, they're
Yeah.
insane.
Or get everybody in a room, get some press coverage, get some.
And that's happening, and I
Get a story
was
out there.
asked if I could be a contact for press to speak to the press. Some
Yeah.
people, they haven't contacted me yet, but this is all still, it's very new, it's
Yeah.
going down.
So I did push back, I mean, I did write him back, I haven't heard back, and his last line is, I am as worried about this as you are.
Yeah, they keep saying that, and they
that
don't.
don't fix it.
Don't fix it.
You know, medical directors are pushing back, EMS is pushing back we are. Maine EMS is not doing anything, and Maine Health is like, it's a cost-cutting measure for them. So, and they're not listening to that, hey, our budgets are already set for the next year.
Well, and I have a feeling Midcoast Hospital guy is like, he's pretty low on the
So,
chain
yeah.
relative.
He's just, yeah.
So I just wanted to bring that to your attention, and I'll be reaching out when I figure out more. I wish I had more tonight. It's just been I've been researching the cost of all the medications today, and
Yeah.
Well, I'll keep pushing. I might see some legislators tomorrow up in Bangor, and if Jim Libby's there, I'll definitely talk to
yeah,
him.
talk to him about it. I'm working on a letter to him because he's looking for data and cost
Okay.
analysis and
Okay.
stuff. And again, the problem is we don't have a lot of this data because we never had to buy
Right.
this.
Well, the hospital should be able to provide it.
Well, they could say how much we've ordered from them,
Yeah.
but their prices
The
are
prices are a
really
lot lower.
low. I mean,
Hmm.
you know, their glucose is like $2 a jar. We would end up paying, or just oral glucose,
Mhm.
like 12 or 14.
And they haven't offered to sell the drugs.
Oh, they just said now their new line is, we can't. They always have been. Said like our distributors won't let us or something. So they changed it from the DEA wouldn't let them to our distributors. So I think there's a lot of waffling going on and changing. But yeah, it's just a concern right
Okay. Hey,
Well,
thank you.
now. I wish I had more on
What's the correct name for this safe?
it. There are different,
Well, you got a safe.
it's a narcotics security safe.
Narcotics
Like-
control.
Like compacts and narcotics
You know
control
people.
safe. And to do it the thing is we can just get one from there. To do it really correctly in future, we get the same model for the trucks to replace what we have in there because it tracks electronically.
The trucks already have safes
Yeah.
in each one.
So, and we've been doing it on paper, the logs and tracking it. So new safes in the truck would track it with, like if it goes from that safe to those, as soon as somebody tags it in, it would say, this person opened the safe, and now this thing is missing. So it's really fancy. I'm trying to find out the budget that would work best for us,
Right.
you know.
Right.
All right, thank you, Dan. Sean?
Three calls so far this month, which isn't too bad. 437's at the shop in Auburn. They're going through the pump and taking care of the leaks that they've had on the pump. While it's there, I told them, I said, just give it a once over. It hasn't seen a shop in a couple of years. They found a set of brakes on the back right were seized. So they're doing brake service on it, oil change, filters while it's there. The MMA grant, that equipment came in today, so I have 2 brand new ice water rescue suits downstairs with the helmets.
Wow.
So
And we just got the money for that yesterday.
perfect, perfect. So,
There we go.
pretty
Wax the
responsive.
zippers. You're
Yeah. We're pretty excited about getting those in service. Yesterday I was able to do a fire truck ride for the 8th grade auction folks that
Oh, neat.
won that. I
Yeah.
took 2 kids to school in the truck yesterday morning. And then I just wanted to put a plug in. Thank you to Quonset Hardscape and Brewers Property Service for donating equipment and material to the State Federation of Firefighters Memorial in Augusta. I was able to take that stuff up yesterday with Sandy Carlton and her and I, along with Ken Desmond and a few folks from the Federation, revamp the garden up there and get it looking good. Especially, I think it was fitting for the time when we just went through last week's issue up in Waldo County. So it was kind of a nice thing to spruce it up there a little bit. So
Where's the funeral for?
I believe it's in Belfast.
Okay, are you going?
It's not open to the public.
Okay.
It's unfortunate, but I understand it.
Yeah.
A line of duty death in the state of Maine is pretty big to a lot of departments, so
Yeah.
we like to support that. But the family put out specific requests that if you're not invited, please don't come.
Mm-hmm.
I understand.
Yeah.
So there's other ways that we can help with that, but
Well, they're gonna. Yeah.
yeah. So anyway.
And so that we did. I did get word. Rob is actually the official flag lowerer and going upper. And so Friday is for.
We were wondering about that.
Yeah, so we'll do it tomorrow for the game warden, and
Right.
we'll just leave it down.
We're talking about the same Rob?
I was wondering about that.
And those husbands?
Yeah.
On the Sears
Mr.
Lawn
Hudson?
incident,
Mr.
Conflict of
Just-
interest.
the Sears Lawn incident, Maine EMS, Woolwich was actually asked to back up, EMS was asked to back up town, Waldeboro, CLC, this guy that might have to go up there in case they had calls during it.
Mhm.
And I'm proud of my crew. We had 7 people step up, take their day off to be ready just in case
Oh,
at the last minute.
yeah.
We also had a couple of our crew that knew
Did you work at BIW?
the firefighter who died, as well as some of the ones that were
Did you know?
injured badly. So we're just trying to keep an eye on them. But our crew was amazing. They just showed up we got the call that there was a MCI. Had no idea. I got a call from Wiscasset saying, "Can you back us up?" And I'm like, "Okay." So I think everybody responded, all fire, EMS, everybody. So it was.
All right,
Thank you.
anything else, Sean?
That's it. I got a boot for you if you want to put that in the town office.
Yeah, put a sign on it, put it down in the lobby.
Oh, that'd be great for donations.
Fundraiser for-
I suggested doing that, we take up a collection for the fire department.
Yeah.
And, just set a booth down there with a sign on it, if people drop money in it, and then we get a total, we'll send them a, send it up.
Before I forget, I'm sure Jason's seen it, but the North Station's, there's some progress on it, painting,
We
and
heard.
looks like they're.
Going in the right direction?
Yeah, it is going in the right direction, so we will, stay tuned.
Okay.
That's my saying, stay tuned.
Old business, we have nothing under old business. Anybody have anything to add under old business? New business, we have nothing. I love it. Anybody have any new business to add? If not, I'd entertain a motion to adjourn.
So moved.
Is there a second?